you can keep your, like bend your knee, keep it there so the patient is confident, nothing is going to happen. So I will just reduce the spasm. In Mumbai, we give steam. We have a jet steam. We give it to the neck and trapezius muscle, so we are very sure there is no spasm. Because if there is spasm and you try to mobilize, you can tear the muscles. See, I'm mobilizing. Right? Same thing I do here. You can mobilize. You're only mobilizing. On this side, you're mobilizing. Extreme left. Right, push, then semi-rotation, flexion, rotate, flexion, full extension. Getting it? So you can do it to all the patient, all this. The click comes when you are very sure there won't be any degenerative changes. See this? Okay, just position it. What more? What more? Okay. You want me to check her again? So physiotherapy is not giving ultrasound and diathermy. Your hand should work. Okay, your hand can do the job. More. Now this side. Both sides more. So I'm still getting movements from your neck. Okay? So now I want to get from your upper back. Somebody had that side. And on your stomach. Go a little bit side. Now, if this length was lower, I could have straight gone. For you all, so that you all know when you all are seeing the patient, you all can go on the length. So you go there. Right? Okay, now you're going to use your body weight. Very simple. So I'll put my hand under the scapula. One and over the scapula. See this? Right? Just twisting and I reverse it. Right? Few pushes, mid-thoracic. Here is where we bend. Right? But whichever side you do, also do the other side. Now look that side. Right? So again, twist, and the other way around. And few pushes. Done. Get it back again. Morning. You all came walking. हाँ? चल के आए? यहाँ आने में ढूंढ रहा था हूँ आप लोगों को. Don't go away or to run away. I'll start all over again then. Okay. You're going to look to the right. Can you see more? More? So this what I got was from the thoracic. Okay. More? दिख रहा है पूरा all अभी. चलो आ जाओ. So now I'm going to get from the lumbar. Okay. Got from the neck, thoracic. I will lie and face. Again. So low back will do very general. Hand bends there. Let the upper leg just fall. Let it just fall. There is a rotation there. Right? And see this? Got it? So now, for the teeny mini girls, you say it will be difficult, na? So the other technique. So you go up, Okay? There, keep the hand there half. So let the leg forward. See this rotation? Right? So I got whatever I had to it from the lumbar. Okay. Huh? So now both sides she's kept. So you know where we started. We started from she could only see the first person, she could see the curtain. Now she can see the whole hall. Even 200 times giving diathermy for non-stop 1 year, and then after that giving ultrasound for 1 year every day, you wouldn't have got this range. So please use your hands. Right? If you don't touch, my first lesson was in third year, it was a frozen shoulder, and our sir was examining the patient because government hospital, Baroda, the patient look up poor. So he just picked the shirt, Aat upar leo, was refusing to touch the patient. Right? And that time we had a classmate, Leena, she was from Fiji. Gujarat is in Fiji settled. She came and sir said, treat the patient. It was shirt utaro. I'm not going to ask you. Right? Shirt utaro and examined her. And we got results. So unless you don't touch, you are not going. So fixing up a diathermy, giving ultrasound. Ultrasounds are great nowadays, you know. We are expert. So as you are giving ultrasound, it's too boring. So you are talking to a friend. Kaisa tha wo picture? So patient, I should tell you, either way. Bata hai. And then somebody dies in the movie. Patient चलो जल रहा है. We are not even bothered. So unless you don't focus, you don't put your heart in the treatment, results don't come. You need to be talking to your patient. You should be nice to your patient, not to your colleagues. Right? So you're treating a patient and talking शाम को कहाँ जाना है, कभी खत्म होगा, हार्डली है लगता है मुझे. हाँ 2 दिन कॉन्फ्रेंस था तो मंडे छुट्टी भी हो सकता है. Eventual मैम के ऊपर ही क्या करेंगे. Is it clear? Now, very important thing I've shown you all about the neck. So please touch the patient, mobilize the patient, and the patient would walk toward you. In comfort treatment now. You're feeling better? Peace all the days. Fine. Is it clear? Do you have any questions here? Down sleep, up sleep, down sleep. What the orthopedics don't see. Yeah. Huh? More upper. Mobilize the upper. It has to. See, there are vertigos which here is involved, and there is vertigo with the spine, the cervical say. If it is from cervical, definitely patient feels better. You have to align it. I said, you mobilize the whole thing. If they go to an ENT, they just check the ear. If it is not from the ear, they refer it to the physiotherapy. It's because of cervical. So mobilize it. I said, any movement that you do, see what is working lower. Right? Vertigo is to with the upper. C1 to C3. So mobilize that. How you are going to mobilize that? Look down in flexion and do chin tucks. Do extension, do chin tucks. So you'll see the C6, C7 working. Okay, so you have to position and then do chin tuck. Everything has to do with chin tuck. Okay. Question? If I don't click also now, she will have relief because I've increased the. I didn't click. I only mobilized it. Right? So till you keep doing it, till you are trained well, till you are very sure you can. So that's why I tick the head always on the chest. So you won't cross the barrier. So it's safe.
Trust gives better results, but the results are also good without the trust, without the click, right?
Okay, so I go for the back. Anybody has a genuine back problem? Come. Come. Thank you.
बिना प्रॉब्लम के तो नहीं आ रहे।
हाथ में क्या मतलब तभी टाइम ना, तो ये चीज़ का दिक्कत है, ये बहुत दिक्कत देता है ना बैक पेन का,
उनको
स्पाइन वाले का। हाँ
अभी तो वो तो तुम्हें पहले ही चोट लगी है तो वो कैसे हो?
लिटाती हूँ वन साइड लेग वगैरह, वो कैसे लिटाती।
So we saw in neck, we were seeing the movement of the neck. For back, I would see the SLR, straight leg raising. So keep your left leg straight. Don't bend your knees. Right. So what do we call it? 60, 70. Yeah. Right. 40. So one thing is clear, the involvement, whatever it is there, has to do with the right side. Okay. So the next thing I will check is just the quadriceps strength. I will ask her to push my hand down. Push it down. Push my hand. Fine. Relax. Push it down. Fine. Almost again here also. So right was weaker. Okay. So bend both your knees. Okay. Now, when they bend the knee, I want the medial malleolus at the same place. Okay, the medial malleolus. It's there. So she's going to lift her hip up. Good up. Okay. So again, the strength is known here. The way she takes it up. One more. Get up. Up. Go down. So I've aligned the spine now. Okay. I wanted the spine to be aligned, so she is not lying down in any crooked way. So in this position, you are not going to do anything. Okay? So I'm going to pull the leg down gradually. Okay? And put my thumb under the medial malleolus. I want somebody to come and witness it. Right? So we said right side was less, right? When we did the SLR, this was 40 and 60 or 70, right? So we asked her to raise her hip up. I pulled it down. So I'm seeing an upslip on the right side. The medial, if I see my thumb here, see, can you all see my position of my thumb? I couldn't see any difference. Okay, so I'm in the same place, medial malleolus. So that means the SI joint has to be like this. Hers is like this. Okay, so every time she is walking, the right leg takes more time to go down. So why the SLR is restricted could be upslip. If the pain was on the left side or the SLR was lesser on the other side, I would have called it downslip of the left side. But she has upslip of the right side. Clear? Okay, so we are going to treat her. Okay, and see whether we can correct it. Anybody wants to just run up, come and witness it. Come and see what I'm saying. It's an upslip. Any of you want to see? You are her friend. Good friend. She wants to witness what is happening to you. See, when I say medial malleolus here, see this. See the difference? This is up. And our SLR was less. So I'm going to give a tug now. There it is. Please always hip knee bend. You are going to take the internal rotation and give a tug. Okay? Never do it in external rotation. If I do like that, maybe I'll have to give her the leg. Right? So I'm going to take internal rotation and tug, tug. and I'll be fair to the other one also. So there and tug. Okay? The other way to give tug is you can hold at the ankle level and take your body weight there. So just fall on it. Okay? You can pull. You say now we are pulling so and so's leg. We are pulling her leg. Okay? So bend your knee again, both. So if it is not corrected, I'll go to the next technique. So again, medial malleolus at the same place. I want her to lift her hip up. Go down. Lift once again. Nice. Up, up, up. Down. Good. I'm showing you where. Yeah, back, back up. Huh? Okay. She did. She did that. What? Up. Go down. Fine. Align this fine. You don't do anything. I'll pull it down gradually. Come here, girl. Come here. What? Corrected. So I've corrected her up slip. Okay. So now we'll strengthen a little bit. Feel off. Bend neck. You're going to push it down. Push it down. Push. 1, 2, 3, 4, 5. Relax. Push again. Push, push, push. Relax. Body controls. Good. The other knee. Push it. Relax. One more push, push. Relax. So now I'll open her back also. Face me. Hand under your head. Hand under your head. Like this. Come on, you come. Fine. Don't do anything. Leave it there. It's all this. And this there. Don't do anything. Hand. Okay. Go the other side. I prefer facing the patient when I'm mobilizing. Come on. Leave your leg there. This goes there. You won't fall. That's fine. Your friend is here to take care of you. Okay. Fine. Okay. So I've corrected the upslip, mobilized the neck. Now suppose assuming a pain was coming down and it was a sciatica pain or a radiating pain. So I'm just showing on her only. Okay. So what I would do. Fine. So I would have opened her upper back, lower back, right? See, I just opened. Right. I would rotate the lower thoracic. That's why the lower thoracic. Okay. Now she will be on her palm. She come on your palm, and you're going to come. Huh? No. No, on your palm. This was good. Straighten your head. Go down. So I'm going to hold it now. I'm coming up to thoracic. So lumbar I'm locking. Up, come up. Go down. Straighten the elbow. Up, go down. I'll come a little lower. L2, go down. Still come up. Go down. SI joint, come up. Go down.